My next question is, if I am recovering from COVID-19 infection, and in case I have a question about, do I need to get vaccinated? And if I need to get vaccinated, when should I get the vaccine? So I think this is a question for a lot of people, and especially the frontline healthcare workers who get this question in communities where information doesn't reach that easily. So if you can tell
Sure.
us about that.
Another important question. So, what happens when we get COVID and recover from COVID? Some individuals, maybe a third, as I mentioned, can get what we call long COVID syndrome, where they continue to experience these symptoms. But generally, when you have a viral infection, you develop something called natural immunity. And natural immunity is this immunity that you get as a result of having the infection that generally prevents you from getting another infection. So most people that have had COVID-19, if you were to test their blood, you'll find that they have antibodies against the virus. And the only problem is it's not clear that having these antibodies will protect you if you're exposed to the virus again, especially if you're exposed to new versions of the virus, like these variants. And it's not clear how long, if you've gotten an infection, how long those antibodies last. Is it 3 weeks? Is it 6 weeks? Is it 3 months? We don't really know. So it's important to remember you may have gotten some short-lived immunity from getting the infection, but again, this natural immunity may not protect you against variants like the Delta variant. And I think this is one of the reasons that the Delta variant spread across India and infected so many people is I think we got complacent and many people thought I had COVID, so I probably can't get it again. And here it rapidly spread throughout the country. And again, you don't know which variant you got when you got infected. Generally, we test for COVID, but we don't test for what kind of variant that you might have had. So your question is an important one. If I've had COVID and I've recovered, do I need to get the vaccination? And the answer is a resounding yes. Absolutely, you need to get the vaccination. And then the question next is, well, how long after having COVID before I can safely get vaccinated? In the US, the guideline is as follows. If you're no longer at risk of exposing other people to the virus, you can get your vaccine at any time. And generally, how do we know that you're no longer at risk? If it has been 10 days since your first symptoms of COVID and you no longer have symptoms, you are no longer infectious. You don't need to get a COVID test to prove that you're no longer infectious. Once it's been 10 days and you feel okay, you are no longer infectious. In India right now, the guidance is to wait 3 months after you've recovered before getting your vaccine. So the question might be, is it dangerous to get the vaccine earlier than 3 months? And the answer is no. As long as it's been 10 days and you're no longer having symptoms and you're no longer infectious, it is safe to get the vaccine. So there's a difference between the US guidelines and the Indian guidelines. So another question that comes up is delaying that second dose of the vaccination harmful or potentially harmful? So this is a very interesting question that's being studied right now. And that is, for some vaccines, if you delay the time between the first and second doses, what we're finding is it actually might be better, and that you might get a stronger immune response to that delay as opposed to the traditional 3 or 4 weeks between doses.
Right.
And the other benefit of extending that window between the first and second dose is that more people have a chance to get the first dose. And that means even though the protection is not as good as 2 doses, it's more protection for more people. And just out of curiosity, there was a recent study of delaying the Pfizer vaccine second dose from 3 to 12 weeks. And what they found was if you delayed it to 12 weeks, that you have a 3-fold higher level of antibodies. But the truth is, we need more data. And I think a lot of people are doing studies right now to see if it's okay to extend that time frame between the first and second dose?
Absolutely. I think when we got AstraZeneca first dose, the healthcare workers in India, around February first week, we were given the second dose in the fourth week of February. But
Hmm.
now, when I got my parents and my sister vaccinated, they have given us a window of 3 months for the second dose. So it will be really interesting, and I will be very happy if this works out better, because I like anyone else is so concerned about my family, and
Of
they need
course. Yes,
um,
absolutely. Absolutely.
I think we have a very important question, which a lot of people have in their mind, and especially for our frontline healthcare workers who can address this question very well. This will help them a lot. Once vaccinated, are there still precautions that should be taken in COVID-19 variants, which are still out there?
That's a great question. It's a question that we're asking ourselves right now in the United States. So let's just talk about immunity after a vaccination. You had mentioned your parents, and the delay of 3 months. So understanding how vaccines work is very important. After you get the first dose, you do get some immunity. And what that first dose does is it initiates this immune response in your body. However, you are still vulnerable to COVID after that first dose. It's very important. When you get the second dose of the vaccine, you get a really robust immune response. This is what we call the booster shot. And then after 2 weeks, generally 2 weeks after that second dose, that's when you get the full immunity from the vaccination. So as you can see, between the first dose and 2 weeks after the second dose, we are still vulnerable to getting the infection. But I think there's an important question that you've posed, which is, does this vaccine protect against the variants?
Yeah.
And to understand that, it's really, you have to understand what the goal of COVID vaccines are. COVID vaccines are not intended to prevent all COVID infections. In fact, no vaccine is 100% effective. The goal of COVID vaccines is to prevent hospitalizations and to prevent deaths. And it does it very well. In the United States and United Kingdom, there is data right now to suggest that both the mRNA vaccines as well as the Oxford AstraZeneca vaccine, or Covishield in India, offer protection against the variants. The problem is there may still be new variants out there that we don't even know about or that are evolving. So, what is my advice? You've been vaccinated, it's been 2 weeks. Is it okay to throw the mask off and go out into public or go into your practice and be fine? My recommendation is one that is a conservative one, which is it's better to be safe than to be sorry. So I would recommend that you continue to wear masks, that you continue to wash your hands and use hand sanitizer, that you continue as best as you can to avoid these high risk environments, stay away from people that you don't know, even if you've been vaccinated, until we have more information, until more of the population has been vaccinated and we can sort of achieve herd immunity, until we know more about the effectiveness against all variants. It's better to exercise caution than to be cavalier.
Absolutely. Absolutely. In fact, we have got so many questions about which vaccine is better. Is it AstraZeneca, which is Covishield in India, or Covaxin here, which is locally being manufactured? And we don't know. As healthcare workers, we do not have the right answer for anyone, but we do tell them whatever you get at this point of time, please go ahead and take it, because there are a lot of people who are not even getting any access to get one dose of vaccine. So I think it's not an option to choose from. So
I have an answer for you for that, for them. If they ask you, which
yes,
vaccination should I get?
yes,
You tell them the best vaccination is the one that's in your arm.
That's so beautiful.
right? Right.
Yes,
That's the best vaccination. It doesn't matter which one it is. If it's in
yes,
your arm, then it has a chance to work. If it's still
ab-
in the bottle, if it's still in the vial, it can't do anything for you. So get the one
ab-
that's available to you.